Picture this for a second. Right now, inside of you, there is a high-speed, completely invisible communication web constantly humming away. It's not made of copper wires or fiber optics, but it's this glowing, three-dimensional network of chemical signals dictating almost every single aspect of your life. I'm talking your energy, your mood, your growth, your raw survival. Welcome to This Explainer. Today we're going to decode the body's hidden network and really dig into the clinical approach to uncovering endocrine disorders.
So how exactly does a single microscopic chemical messenger command such massive biological changes across your entire body? Just visualize a tiny drop of a chemical being released in one specific area, traveling along your body's hidden vascular pathways, and then boom, suddenly triggering a cascade of powerful reactions in a completely different organ. It's absolutely awe-inspiring biology. And, to truly grasp how we diagnose the system when it goes wrong, we first have to understand how flawlessly it functions when it goes right.
Let's kick things off with Section 1, the Hidden Communication Network, looking closely at the integrated signals of the human body.
To really get endocrinology, we have to realize that our intercellular communication is a brilliantly, tightly integrated network. The endocrine, nervous, and immune systems don't just work in isolation. They're constantly talking, constantly maintaining this delicate balance. But how do they actually deliver the mail? Well, we categorize these chemical products by how far they travel. Think of it like a cellular postal service. First up, you have autocrine signaling. This is when a hormone acts directly on the cell that made it. It's like insulin or leptin basically checking in on themselves. Then there's paracrine signaling, where messengers like gastrin act on nearby cells, essentially just chatting with their immediate neighbors. And finally, true endocrine signaling. This is the long-distance haul, where hormones like oxytocin, vasopressin, or growth hormone-releasing hormone travel to entirely different, far-off sites in the body.
Moving right along to Section 2, diverse glands, where we'll be mapping the sources.
If the hormones are the messengers, where exactly are the factories making them? We traditionally think of a few specific heavyweights, right? You've got the major hubs, the pituitary gland up top, the butterfly-shaped thyroid in your neck, and the adrenal gland sitting right there on the kidneys. And for the longest time, these were considered the primary, almost exclusive hubs of this entire chemical network. But as our understanding has evolved, well, so has our map.
Take a look at the brain itself. It actually acts as a massive, non-traditional gland. The whole field of neuroendocrinology has revealed that the central nervous system regulates the pituitary via hypothalamic releasing factors, churning out crucial peptide hormones. So, the brain isn't just the electrical command center, it is a major chemical factory in its own right.
And it absolutely doesn't stop there. Let's rapid fire through some other really unexpected hormone sources. Your gastrointestinal tract? Yeah, it produces ghrelin, which signals when you're hungry. Your adipose tissue, your body fat, it produces leptin and adiponectin. Even your heart and kidneys are getting in on the action. The crucial takeaway here is that you have to stop thinking of the endocrine system as just a handful of isolated glands. Virtually your entire body operates as one giant functional endocrine organ.
Which brings us to Section 3, disease mechanisms, or what happens when the network actually fails.
So how does this highly regulated, perfect system break down into clinical disease? We can trace failures back to four main mechanisms. First, there's excess, which might show up physically as rapid weight loss or severe tremors. Then, deficiency, which is often seen as this profound, unyielding fatigue. You also have hypersensitivity, where the body completely overreacts, and resistance, where the body just flat out ignores the signal. And each of these mechanisms can be broken down into a primary cause, meaning it's happening directly at the gland itself, or a secondary cause, which is driven by trophic substances acting on the gland.
Let's dive a little deeper into hormone excess. How exactly does the body accidentally flood the system? Well, one way is through neoplastic growths. These are things like benign tumors in the pituitary or adrenals that simply ignore the body's negative feedback rules and start overproducing. Then you have autoimmune disorders, where the immune system totally goes rogue. In Graves' disease, for example, rogue antibodies literally mimic thyroid-stimulating hormone, forcing the thyroid into absolute overdrive. We also see genetic factors like activating mutations in GPCRs and MEN syndromes, specifically MEN1 and MEN2, where specific genetic mutations lead to multiple endocrine tumors at once.
Now let's shift gears for Section 4, decoding hormone resistance, the illusion of normalcy.
Resistance is a truly fascinating yet incredibly deceptive state. This is when the factory is working perfectly. Hormone levels might even be sky high, but the network still totally fails because the target organs are completely ignoring the signals flooding the body. We usually distinguish between two main types here. First, there are rare inherited genetic defects. Take complete androgen resistance, for instance, where XY males present with a female phenotype because their receptors possess genetic mutations, making them totally blind to high testosterone levels. On the flip side, we have extremely common acquired functional resistance. Think of the insulin resistance we see in type 2 diabetes or leptin resistance in obesity. The hormone is definitely there, but the cell has just locked its doors.
All right, time to put on our detective hats for Section 5, the diagnostic approach, investigating the elusive.
Because endocrine symptoms are notoriously vague, entering the investigation phase is incredibly tough. I mean, just look at the astonishing number of variables that can skew your hormone data. If you're measuring cortisol, the time of day completely changes the baseline. Measuring renin or aldosterone, well, the patient's posture and their dietary sodium intake suddenly matter a lot. Actually, even the pure stress of having an indwelling needle inserted to draw the blood can spike stress hormones like catecholamines or prolactin. It perfectly illustrates exactly why solving these clinical cases requires looking at the full context of the patient and not just focusing on a single number on a lab page.
Because of all those crazy variables, we absolutely must strictly enforce the diagnostic protocol. Step 1 is always biochemical laboratory testing. And we don't just take static measurements. We rely heavily on dynamic testing principles. We try to stimulate a suspected deficiency or suppress a suspected excess just to see if the feedback loop is truly broken. Only after achieving quantitative confirmation do you ever move to Step 2, radiologic imaging, like a CT, MRI, or ultrasound. If you image first, you run a huge risk of finding a harmless, non-functioning incidental tumor and jumping to entirely the wrong conclusion.
A core truth of endocrinology you've got to remember is that hormonal assays are not magic bullets. Lab tests alone are not going to solve the case for you. A highly systematic approach, combining a thorough patient history, meticulous physical exams to look for those really subtle physical presentations, and targeted studies is absolutely required.
When you look at the global landscape, endocrine diseases, particularly acquired conditions like diabetes and obesity-related metabolic syndromes, are significantly on the rise, especially in developing countries. The stakes are incredibly high right now. But there is a very powerful message of hope here, too. When we apply this rigorous, systematic approach and effectively manage these specific syndromes, it consistently results in a remarkably good quality of life and longevity for the patient.
So, as we wrap up this explainer, I want to leave you with a somewhat provocative thought to carry with you today. Every single second of every single day, a silent chemical symphony is perfectly coordinating your breathing, your hunger, your stress, and your sleep. What hidden messages is your internal network sending right now? Thank you so much for exploring the fascinating world of the endocrine system with me. Keep wondering, keep learning, and I'll catch you in the next explainer.